Ladies and gentlemen, my name is Zachary Nider, and I'm a master's student in the Health Policy and Management Department and a co-chair of the Student Leadership Circle, a committee instrumental in supporting and marketing the Voices events. It is my distinct honor to introduce today's Voices speaker, President Felipe Calderón, former President of Mexico. During his time in office, President Calderón's policies had pronounced success within the business, environmental, and educational sectors, yet some of his administration's greatest achievements were accomplished within the health sector. From as early as his Inauguration Day address, President Calderón made it clear that broad access to health services would be a high priority. His government continued the successful and widely celebrated comprehensive insurance program known as Seguro Popular, as well as working to expand infrastructure to ensure high-quality care and services. With the global financial crisis leading to difficult choices within governments across the world, President Calderón ensured that the health agenda received the necessary funding to guarantee the sustainability of Mexico's push towards universal health insurance coverage. In August 2012, it was announced that Mexico had successfully realized this monumental achievement, enrolling over 50 million people in health insurance in less than a decade and attaining universal coverage. President Calderón's focus on population health also included the establishment of the Mexican Genome Project, which was created in response to risks posed by potential global pandemics. The project has also helped assist in the targeting of diseases through the identification of specific genetic markers. President Calderón has received numerous awards and recognition, including the World Economic Forum Global Leadership Statesmanship Award in 2012. Since completing his term late last year, President Calderón is now the first Angelopoulos Global Public Leaders Fellow at the Kennedy School. Before I turn the session over to Dr. Barry Bloom, who will be moderating today, please join me in welcoming President Calderón to the Harvard School of Public Health and to the Decision-Making Voices from the Field Leadership Series.
Thank you. Thank you. Thank you very much. Thank you.
Thank you so much, Zachary. Good afternoon and welcome to this Decision-Making Voices from the Field Leadership webcast conversation. We're enormously pleased to have former President Felipe Calderón of Mexico as our guest speaker today. The Leadership Series focuses on leaders around the world who've made major contributions in the world of public service, of business, and health, and who have had to make difficult decisions during the course of their career, and we ask that they share those experiences with us. We have today a webcast that will go worldwide and probably reach over 190 countries. And we hope that you will enjoy the session as much as the audience here expects to do so. We have an audience in the studio comprised of faculty and students from the Harvard School of Public Health, and we look forward to hearing lots of questions from them. And I would ask them to begin to think about the kinds of questions they would like to ask. But I'd like to begin the discussion on the issue of public service, which is so important in the area of public health, and ask President Calderón what his reflections are of a major term in public service in Mexico.
Well, thank you very well. Thanks for your words and thanks for these invitations. What I can say about public service is that first, public service is about principles and beliefs. If you are not able to believe that you can change the reality of thousands or probably millions of people, you are not going to make it. Public service, if it is honestly carried on, implies a lot of sacrifice. So you need to be strong. And the only way to do that is being a man or woman with principles, ideals, and values. Second, public service is about priorities and decisions. It is impossible to afford all the human needs. It is impossible to fix all the problems. It is impossible to address all the necessities of the people. So the resources are scarce, or you have not enough money to do everything, so you need to decide and to establish some priorities. And doing so, we follow a very wise expression of among the Mexican people and probably among other people, which is health becomes first. Health is first. In any family, if some member of the family, a kid or the mother or whatever, has some problems, some disease, some accidents, all the family will to pay and sacrifice anything in order to afford the hospitals or the doctors' expenses. So health is first. So if that is the popular wisdom for the government was the wisdom as well. So we decided to put health first. Other point is there is an expression which says that love which is not expressed or reflected in the budget, it is not true love. So we decided to apply or to express our priorities in the budget. I remember that when I was designing with my team during the transition term as president-elect, the budget for the first year of my tenure, I asked the head of my staff at that time, well, what do we need in order to reach universal health coverage in Mexico during these 6 years? So, Mr. President, that's impossible. But why? It implies a lot of money. We cannot afford. So tell me a number. Mr. President, we need to multiply by 5 or by 6 the budget, for instance, Seguro Popular, which was put in place by Julio Frank, the dean of the school. So, but, well, please form in the budget, multiply, starting by 2, the budget for that. Well, where we can get the money? Well, so you need to sacrifice all the programs. And we reduced the budget for a lot of programs in agricultural sector, for instance, which is a sector which has a lot of deviations because the rich people, for instance, in rural areas are getting most of the subsidies there. So we reduce and we increase the budget for Seguro Popular. And at the end of my tenure, we multiply by 5 the budget. And we reach universal health coverage. So we passed from almost, at the beginning of my government, probably less than 60 million people out of 112 million Mexicans had some kind of health coverage from public insurance. And at the end of my tenure, we reached 106 million people covered with some kind of insurance, either Social Security or Social Security for public workers or Seguro Popular. So, and that implied to multiply the budget for Seguro Popular and multiply the budget for infrastructure in health system. So at the end, we built like 1,200 new hospitals or clinics, and we rebuilt 2,500 more in addition to that. So we rebuilt the whole infrastructure system in Mexico. And the last one could be, you need to take decisions. So the most difficult aspect of public service is taking decisions. And sometimes once you can believe that you can take decisions between the good and the bad. You know? But the problem is that being public servants, you need to take decisions most of the time between the less of 2 evils. So always there is some cost, some sacrifice. Any decision, any serious decisions implies sacrificing something, sacrificing money, sacrificing or taking more taxes, or sacrificing popularity or public support or whatever, or paying a very high cost in terms of either political or economic cost. So that could be my initial reflections, Barry.
So as you know, thank you very much for that, which really sets the stage for a really interesting discussion. As you are acutely aware, new strains of influenza, when they arise and infect people who've not previously seen them, have the potential to cause global pandemics. During your presidency, a new strain, H1N1, that had the same name, in essence, as the 1918 influenza that killed 50 million people, arose in Mexico and was declared by the World Health Organization to be a global pandemic. Can you share with us some of the tough decisions you had to make when dealing with that pandemic and how you balanced the protection of the people's health with the potential harm to the economy caused by this pandemic that arose in Mexico?
Well, that's exactly one of the cases in which you need to decide, regardless you have not enough information. What exactly we had at that time? First, like 1 month before I realized, even reading the daily report I received as president, that in some hospitals we started to see some people dying in a very weird situation. We were talking about very young people in 20s or 30, healthy people, dying by typical pneumonias. So I asked the Secretary of Health that what is happening, Secretary, the Dr. Cordoba. He told me, well, we do believe that it could be like any flu, probably delayed because we were in April at that time. But let me check. So he took some samples from all the people and sent those samples to a very special lab in Chicago. I don't know, I don't remember the name even. And I'm sorry for that, but the American lab took a lot of time to do that and never responded to it. So we sent another set of samples to the Canadian lab in Toronto because the Canadian developed after SARS a quite interesting system. And finally, one afternoon, it was like a Thursday, I remember, and Secretary of Health called me by phone and said, Mr. President, it's urgent, I need to see you immediately. I received the outcome of the samples, and it's something serious. I received him in my office 20 minutes later. He told me, well, the outcome is like this. This is an unknown virus, it's a new one. Of course, it's lethal, we know that. Meanwhile, we don't know exactly how to cure that, and we have no idea about the rate of lethality. We started to observe even more people arriving to the hospitals. So we took some projections that quite important public servants did in the past. For instance, in one scenario, we were expecting that if some rate of lethality of the virus and some rate of propagation of the virus or contagious of the virus, after 3 weeks could cause like more than 50,000 casualties. Probably more than 250,000 people getting sick or looking for attention in the hospitals. Actually, at that moment, we started to see that we are not able to afford the people looking the support, for instance, of one respirators in the hospital. So we saw clearly a health crisis at that moment. And the biggest problem is the lack of information because, yes, we can assume that it could be like any normal flu virus, or we have no idea, it could be a very lethal virus, could be the virus like in the second decade of the last century, or could be even the avian flu or something like that. You know, the avian flu has a rate of lethality of 60%. So we have no idea. We decided to protect the people and prevent the worst case scenario. One additional problem, the outbreak of the flu was exactly in Mexico City with a population of 23 million people. So we decided to make something like shut down the city that weekend in order to delay the propagation of the virus. So the ministry went to the TV under my order, ordered to close the elementary schools and secondary schools at the time, asking for universities to do the same. Friday, we had a holiday the following Sunday, so Monday, so it was very useful for us. We asked for the private sector to close business Friday and Monday. So finally, Mexico City was paralyzed. At the same time, we started to express a policy of full disclosure, because the secretary told me, we have not information yet about this virus, so you need to go to the public, you need to be completely honest about what is happening, and if you have information that 10 people died today, or 2 or 10 or 100, you will say exactly that. Today, 10 people died in that hospital or that or those hospitals, and we are receiving this amount of people every day in the hospitals. And you can see clearly, we started to depict it in a wall, the rate of the number of people going to the hospitals at that time. And you can see dramatically how the number of people started to grow, reaching several peaks, and actually several hospitals were unable to attend more people. So the situation was really serious. But after that, finally we discovered, like 2 or 3 days later, with information of the labs, that the virus could be addressed with Tamiflu and other ordinary medication. So we started to provide the people with that. We get a lot of Tamiflu doses, and I protected them even with the army and distributed across the country, because the panic of the people was it could be a serious issue. Fortunately, the people, Mexican people, were incredibly serious and respectful, and everyone followed the instructions of the government. So at the very end, there were several upsides of this. For instance, as long we recommended to wash the hands and avoid kissing, for instance, we Mexican people love to kiss all the time, no? Men to women, so we needed to avoid that at that time. But the people started to follow that instructions, and we got some kind of improvement in our health system. For instance, the average of days in the hospitals of the people who was sick for anything, respiratory disease, like the average in the hospital could be like 9 or 10 days. After all these measures, the average of days of that people went down to 4 days only, because they got to the hospital earlier, in a very early symptoms of the disease, any respiratory disease. They got the right diagnosis, they got the right medicine, so they cure faster. We reduce the number of diseases of, for instance, gastrointestinal diseases, because people start to wash frequently hands and so on. So it was a very tough experience. And at the same time, this scandal around the world, because yes, the H1N1 reached the highest level according to the World Health Organizations, it's number 6 level or something like that. But nevertheless, we decided to be absolutely transparent on that. Full disclosure was the name of the game for us. And it's a question of this taking decisions in a very hard scenario with lack of information. Assume that you are the pilot of one plane, and you are seeing nothing. You are absolutely blind. In that moment, you need to figure out what is the size of the mountain. Yes, the mountain could be like a very small hill, but the mountain could be the Everest or whatever. So you need to decide, thinking in the worst case scenario. Because if you take the ground decisions and maybe you fly too high, and the day after it was a teeny hill, maybe you say, well, you overreacted. And always there is, what is the expression in the United States, the Monday night quarterback, no? So you have the reason after the game, yes. But what about the other way around, no? If you decide that you can afford, no, with the same altitude, and suddenly you face the mountain, you have no time to react. So we decided under those bases, so that was the story.
I think you did very well, and the world did very well because of the responses initiated in Mexico. Let me now throw it open to the students and faculty here in the studio and ask if we could have some questions. Please, first row.
Hi, my name is Leo. I'm from Argentina. I'm an MPH student here in the Healthcare Policy and Management concentration with a policy track, and I'm also a member of the Student Leadership Circle. And so when you got into the office, there were 50 million Mexicans that were uninsured. And yourself, with Julio, developed this whole idea of Seguro Popular, which was fantastic. And you were mentioning that taking decisions is vital for a policy creator, policymaker. And so my question is, what were the main challenges that you faced when you were trying to establish Seguro Popular in Mexico and trying to achieve universal healthcare coverage besides the money?
Could I just ask you to amplify on that wonderful question to explain what Seguro Popular is for the audience who will be watching in the webcast?
I think it's, well, let me start with this, and thank you for your question. One is, we in Mexico before, we had like two public system of health insurances. One was the traditional Social Security, which is carried on by the entrepreneurs and the workers itself. They paid like a quota. They made a fee of payment in order to pay the Social Security insurance. And we had another system which is the same, but not for private workers, but for public servants, the ISSSTE. But beyond that, we have a lot of people, 50 million people, almost half of the population, without any kind of health insurance coverage. So Julio designed the Seguro Popular, which is a new insurance in which the government pay the cost of the insurance to the provider of the health services. In this case, the provider of health services are the local public systems in the states. And probably that is, so we put the money, we pay to each local health system a per capita amount for each people under insurance. And with that money, the health systems could provide salaries for doctors, nurses, and even that money assumes that that money is going to help to build new facilities and infrastructure. Beyond that, we paid for the infrastructure in those states. So it was a massive effort in order to build the infrastructure required for that. I cannot remember exactly the figures, but for instance, during my tenure, we hired probably 30,000 new medical doctors to the system and almost 60,000 new nurses for the system. So that was possible to afford through Seguro Popular. And all those thousands of new or rebuilt hospitals and clinics. It could be small clinics with 4 or 5 beds, or it could be some hospital with 200 beds, for instance. What could be the most challenging issue? Probably the lack of responsibility of some local systems. So because we paid, in some cases, billions of pesos to one government in one state, my own state, Michoacán, for instance. In Michoacán, I remember it was my own state, and we put special attention. I say that all the states are the same, are equal, but there are some more equal than others. You know? So a lot of hospitals and clinics everywhere, and put a lot of money with Seguro Popular. Federal servants went town by town, getting the insurance to the people. The people were registering, bring the kids to the hospital and so on. And the money we gave to the government, most of them never went to the hospitals. So there was a disaster in the treasury in the state, and that was the most challenging issue, the lack of responsibility. It's very easy when the political system has not enough accountability measures or mechanism. A lot of people just got the money and never responds to the the people. So probably we need to fix that. Probably it's a chronic issue in the Mexican system. We have a federal system, but we have not the right incentives to well performing of the system. So the states have a lot of rights, if I can say that. The federal government has a lot of liabilities with them, but you cannot, or you have not enough mechanism to get some kind of accountability from them. That could be maybe the most challenging issue even today, because the insurance is there, the money is there, the infrastructure is there, but all you need is that the provider or the people who are on charge to provide the final health service to the people do their work.
As you know, President Calderón, we in this country have passed the Affordable Care Act, which will go into force in about 2 weeks. And there is great controversy in this country. Lots of people feel it will be a wonderful thing and reach vast numbers of people who are not insured, and others feel that we can't afford it or it will cause many problems. 2 questions related. First, is the Seguro Popular appreciated by the public in Mexico now that it has been instituted? And do you have any advice for us in this country?
Well, the answer to the second question is no.
A true politician.
But for the first, yes, absolutely appreciated. So the levels of support of Seguro Popular are amazing. I don't know, probably it's the most appreciated public program by the people. But let me tell you, I think it's a question of principles. So again, health is the first. Health becomes first. If you want to provide a human society with the basic conditions to live, so the first one is to be able to get medical services, regardless your economic condition. That's the issue. Because it doesn't depend of the people, your health system. I mean, the first rule to break the justice in the society is that some people have full opportunities for anything, to study, to have self-service or whatever, and a lot of people have not opportunities. So we are exacerbating the social differences, and we are exacerbating misery because for instance, the lack of public or some kind of insurance for the poorest people in terms of health system is it causes not only damage to their health, but also to their economy. Again, because when one member of the family has a problem, an accident or whatever, the family needs to expend everything on that member. So if the family is poor, the family will be even more poor. Why? Because they need to borrow money from some abusive men in the neighborhood, so they need to sell their homes or whatever in order to cure that people. So this is catastrophic expenditure, which is exacerbating poverty. So you need to avoid that, and it's good in social and economic terms. Second, so you have money as government. You need to establish priorities. Maybe the government, in several countries, in the case of Mexico, for instance, we make several mistakes. For instance, subsidizing fossil fuels still. Actually, I started a program in order to reduce and even eliminate fossil fuels gradually. But the point is we are spending a lot of money in several things that they are not exactly priorities. Finally, you can see the outcome of your effort in an incredible way. Let me tell you one story, for instance. In 2009, one of the systems of Seguro Popular it has a basic list of diseases and services, which is the basic frame of that. In 2008, we decided to incorporate the cancer treatment for children. Under 18, the program was all the cancer for all the children. So before that measure, for instance, in the case of leukemia, 7 out of 10 kids with leukemia died. And today, 7 out of 10 kids with leukemia survive. So you can see the change in those families and the reality of those kids. It's very emotional for me, and a lot of examples of that. You cannot pay that with anything.
Wonderful. Other questions from the floor? Please. Wait for the mic.
Hi, my name is Nicole. I'm a PhD student in biological sciences of public health. I had a question about sort of the scientific infrastructure and science diplomacy. So you had the experience of contacting Toronto for their previous experience with SARS and with your own experience with H1N1. How did that help develop your disease surveillance program? And then also, how did this epidemic affect your relationship with other countries?
Good question. Well, one is, well, first, the situation is we had not at that time in Mexico the lab capacity to detect the virus. 2 weeks later, we have the same kind of labs or equipment in every single capital of the states in Mexico. So today, we are able to detect and analyze the virus in 32 cities in the country. So in order to do that, I sent, for instance, I put all the resources of the government with that priority. For instance, there was a lack of capacity in the Secretary of Health, no? And the people in the institute with the lab was, of course, overwhelmed with the problem, blind of the work. No, it was impossible to. Of course, we asked her, the director, please get the instruments you need, and she was like working around the clock. So I asked, to the Social Development Secretary in Mexico. I took him away from his daily work and said, you need to go to the state of the art technology. You need to take that and take the money you need. And I published a special decree to the extraordinary conditions. So he went with his team to get the equipment, the instruments, the capability, and organize like a task force in order to build the labs immediately, like an emergency situation. So we built the lab like in 15 days. This was an incredible. When I saw the machines, by the way, I was imagining like in the TV shows when I was a child, a lot of lamps and bulbs and so. No, it's like a printer or something like that. No? It's a little bit disappointing for me, but very expensive to be a printer. But anyway, but we did so. And the other, there was some bad feelings. For instance, a group of Mexican tourists went to China. And the Chinese government didn't allow them to get out of the plane. And after 2 days, they allowed to be in a hotel, absolutely isolated in a very. Some moments was very humiliating for them and their families. So I sent a plane to get them, and they came back, and it was a difficult moment. I had a plan to have a state visit to Cuba, for instance, those days, so 1 month later, something like that. So the Cuban government decided to cancel all the planes coming from Mexico. And a lot of countries, France, Sarkozy made the same. I think it's the lack of information, or I don't want to say other word. But the point is, it was absurd because in this case, that kind of disease, you cannot stop them in that way. So you need to take the measures, and it's impossible to stop the flow of the virus in that way. But anyway, finally we fixed the situation, and we were preparing my state visit to Cuba. I said, wait, I cannot go to Cuba because the government forbidden flights coming from Mexico to Cuba. So it was a difficult situation, no. But it was a very difficult moment indeed, no. I did prefer at that time to be absolutely transparent instead to hide the data of the problem. In some governments, for instance, in the case of SARS, or in the case of even the avian flu, we as human community, we have lack of information, which is really dangerous. We have no idea, for instance, what is happening right now. 2 months ago or 1 month ago, there was one case of human transmission of avian flu. Finally, we got information about that, but before that, we didn't know what exactly is happening with that.
Information is key. Who's next for a question? Yes, young lady here.
Hi, Suzanne Brundage. I'm a master's student in the Health Policy and Management program. Many of us in the United States have looked with great sympathy to the drug violence taking place along our border. And one way to look at that problem is through a traditional law enforcement security lens. But it's also a public health problem. And I wonder, to what extent have you examined that issue as a public health challenge, and what different solutions might come from looking at it as such a challenge, and whether there are any international diplomacy solutions as well that you would hope to see between our two countries?
Well, good question. Do you have time? Because
We have a few minutes.
I need some hours to talk about it. Yes, we saw in the same way. It's a health problem, addiction mainly. Actually, one of the actions we took, it's a very complex problem. I don't know where to start, but let me try to figure out if I can do that through your question. It's a health problem, and we work a lot preventing addiction and treating addiction among teenagers and young people. Actually, we built almost 400 centers of prevention and treatment of addictions in the country. By far, is the largest program of prevention ever. And Margarita, my wife, started a program called Nueva Vida, New Life, in which we teach, or she and her team started to teach professors, parents, volunteers, Red Cross, parish, churches, and the idea is to establish like a flow and to teach to the parents to talk with the child, and to teach to the parents to realize if your son or daughter is getting troubled with drugs, and to pay attention about the kind of friends, and to how to establish a link and connections, and how to treat that, how to address the issue. And actually, probably through that program passed like almost 1 million people in 4 years. It was very, very impressive. We work a lot, for instance, in some of the psychiatry institutions. We are pushing a lot research and programs. Actually, Mexican doctors are almost reaching like a vaccine against the addictions to cocaine. And so we work on several fronts. Second, for me, the issue is not about drugs. It's not about war on drugs. The issue for me in terms of security was exactly that. How to protect the Mexican families who are threatened by organized crime, which is a very different phenomenon than only drugs itself. Actually, one of my most important problems I had is the communicational problem, because here in the States, the only interpretation of the problem is war on drugs. And this situation is because in the 70s, President Nixon coined the expression war on drugs. He declared the drugs the #1 enemy of the United States, and everything related with Mexico and violence is, in this frame, related to war on drugs. Yes, it's linked with drugs, but it's not the war on drugs. For me, the key issue is to establish the rule of law in Mexico, to protect the security of Mexican families, and to make Mexico a different country in terms of security levels. Now, what is the problem in the country? The problem started, actually, for instance, during my government, we decriminalized the personal consumption of drugs. So the personal doses of marijuana or cocaine or even heroin or The law established some levels consider personal doses and is decriminalized. It's not a felony. Now, what is the problem in Mexico? Mexico started to be a very powerful economy since 90s, probably after NAFTA. The income per capita, for instance, under PPP, passed from $2,000 to $15,000. Actually, Goldman Sachs considers that Mexican economy could be the 5th or the 6th largest economy in the world by the year 50. In that sense, Mexico became a very important market for consumption from any goods or services. Very important market for housing, vehicles, iPhones, whatever. And very important market for drugs as well. And that is important because the traditional business of the criminals were exactly narco traffic. Literally, trafficking narcotics to U.S. But when Mexico started to be a very important market, they started besides that, they started a new business which is retailing drugs. So we say the problem is passing from narcotráfico to narcomenudeo, we say. So retailing drugs is absolutely different from exporting drugs. No? Exporting drugs to U.S. is like a logistical and transport issue. Retailing is an issue related with controlling multiple point of sales, which implies a quite important difference, which is the control of the territory. You want to export 1 ton of drugs from Mazatlan to Tucson, you need to control the authority in the line towards the U.S. The highway, you need to control 1 point of the border. You need to bribe American authorities in the border, custom, migration, and several of them. Of course, they are under briefs. But that is the issue, exporting. But now, what happens if you want to sell that ton of drug in one city, Ciudad Juárez, for instance, or Nogales? You need to control probably 600 point of sales of the drug in the city. In order to do that, you need a net over that. Other question, how many people you need to cross 1 ton of cocaine from Mexico to U.S.? Probably the driver, 10 people helping them, other 10 protecting them, other 10 bribing the authorities, I don't know. 20, 50, 100 you want? Now, the same question is, how many people do you need in order to sell 1 gram samples of cocaine or 1 gram bags? By the way, how many bags are of 1 gram are coming from 1 ton of cocaine? Question for everyone. 1 million. You need to sell 1 million bags. How many people do you need in order to sell 1 million bags in 1 week? You need thousands of people. So they started to create powerful nets among young people. There are very important Harvard professors in the 70s who studied the organized crime here in Boston, Professor Schelling. Unfortunately, he passed away. But he said what's a very important thing. At the very end, the business of organized crime is extortion. It's extortioning. Yes, they start to be organized crime because he started providing a very important service or good to the society, which is against the law. And that could be illicit games, or that could be alcohol or drugs or prostitution or whatever. But there is one point in which organized crime is so sophisticated that they upgrade their activities. And now the most important business is not the original business. The important business is to have the control of that street, of that neighborhood, of that city, and start to bribe people against the law. And then they start to collect money, for instance, from the prostitutes, or for the guy who has a forbidden game house or any illegal activities. And the question of sharing is, why are they extortioning people under illegal activities? And the answer is because they have not any legal instrument to defend themselves. So they have no option but pay the extortion. So the new business is extortioning. And my definition of organized crime is that kind of crime which through the violence or threatening try to collect the rents, licit or illicit rents in one society. So we arrived to the problem in Mexico. We started to see people who is kidnapped or extorted, or people who need to pay some kind of fee to the criminals. And what is the difference? That the organized crime was not able to took over the Boston police in the 60s. But organized crime in Mexico has been able to took over the police corps in several cities and states in Mexico. And what I found is they were in control of the city, and they were extorting and kidnapping the people. So coming back to my initial point, my problem was not war on drugs. My problem was security of the families and protecting the families. So I started this strategy. It was a comprehensive strategy with 3 points. Facing the criminals, because in the traditional business of exporting to US, it was very easy to say, I don't care about the criminals, let them, it's a gringo problem, and so on. And the common learning was, don't face the criminals. So I need to start to face the criminals, because they appeared in 20 vans in the streets full of weapons. And I start to face the criminals with full force of the state, including, yes, the army, because there is not other capacity to defeat them. You can imagine 10 cops with 38 guns, no, facing guys with matching guns caliber 50. So it's impossible. Second, and more important, rebuild law enforcement agencies and institutions. And I established and passed in the Congress a law in which any single top officer in police corps needs to be vetted. So we started to introduce exams, psychological, toxicological, polygraph exams to top police officers, and even all the members of police corps at federal level. And we pushed a lot to do the same at the state level, and several governments rejected that. They did prefer to stay like that. And third, and even more important, to rebuild the social fabric. And that was another reason why we not only provide universal health care, but also we built like 140 new universities and 1,100 new high schools, all of them public and tuition-free universities and high schools. And with that, we made a very important effort to rescue that. So that's more or less my answer. There could be options, yes. Actually, I proposed with the President of Colombia and the President of Guatemala in United Nations. I proposed and demanded new discussions about universal policy about drugs. Because we estimated that, to be honest, the American society don't care about the problems. Look, this point related with the weapons. During my tenure, we seized 160,000 weapons. Almost 90% of them were sold legally here in the States. There are 8 gun shops in the border with Mexico per each Walmart in the United States. And all those weapons are killing Mexican people. And you can see clearly a clear correlation between the moment in which one society has a tremendous availability of weapons and the rate of homicides in those societies. You can see that, for instance, in Africa, after a civil war. You can see that in El Salvador after the guerrillas and so on. And at that time, in those countries, is because the civil war or the guerrilla. In Mexico, is because in 2004, the Congress and the American government, they rejected they allowed to expire the assault weapons ban. And since then, you can see a clear correlation between the rate of homicides in Mexico and this new situation. And the people don't care about this regulation. The government failed, the Democrats failed, the Republicans failed about that. And we are paying a very high cost for that.
That's an example of a set of very, very tough decisions. Let me conclude this discussion, if I may, with a couple questions that I think are shared by every leader, even former deans, which is ask your reflections on two questions. One is how you would like to see your legacy remembered by the people of Mexico and the outside world. And the second question is, if you were looking at your tenure as president 25 years from now, looking back, what would you have liked to have done that you were not able to, or not done that you chose to do?
Well, talking about legacy is difficult, of course. I think a good legacy, it is the universal health coverage by any means. Probably for Mexican people, they don't realize the size of the effort because they have already, you know. I remember the opinion polls at the beginning, lack of health services was on the top 5 problems of the people in opinion polls, or even in some cases on the top 3 problems of the people. Today, lack of health services doesn't appear in opinion polls. So for the people, this like that is they take it for granted, if I can say that that's good, but that's one important point, legacy. We made a lot in terms of infrastructure. We created, even in the middle of the crisis, we acted in a very aggressive manner in order to rebump the economy, to put in place counter-cyclical measures. And actually, the Mexican economy went very well after that. It was almost 4 years growing at a rate of 4.3% on average from 2009 in the middle to 2012. Created almost 2.5 million formal jobs. But the people will remember that age, not by the recovery of the Mexican economy, but the economic crisis itself. So I'm talking about the second 25 years. Well, one is, I would like to make the reforms that Mexico needs, which is, it's possible that Mexico will do that right now, education and energy, because the new administration, the new president has one thing that I didn't have, which is the support of political parties in the opposition. Of course, any government change is related to the other, but what is changing in Mexico exactly right now, more than the government, what is changing is the opposition. You know? And the opposition is very responsible today, and I would like to have that in order to make the energy reform. I proposed one to the Congress. It was rejected, most of them. Other thing is, I would like to have to finish this rebuild process in enforcement agencies in Mexico. It's crucial. It's crucial. And maybe I could have analyzing. I would say that I would prefer to have a better relationship with the Congress. I did so at the beginning, and then my right hand died in an airplane crash. She was Secretary of Interior. And for one or another reason, I left the relations with the Congress. We were very close. We had a very close relationship with them. We had breakfast every Friday with congressmen and talk with them. And suddenly I say, well, I forgot that, or I leave that. I didn't want to do the same. And it was probably a failure, or not failure, but maybe the relationship could be very helpful for the government.
Last word is your advice in a democratic society with wide differences in views on every issue. How do you bring people together? Clearly, you've indicated in the case of influenza, information and transparency. How do you see the role of leadership in bringing disparate views to compromise together?
But it's difficult. As you know, I won by 0.5% of the votes in a very tight election. But all the time I try to be a president performing with honesty in office. I mean, I try to be honest with the people. I talk always with my beliefs and principles. And I try to listen to people. That is very important. One of the big mistakes of any leader is, especially in very technical areas like yours, we tend to believe that the technical answers are the right answers. But being in government is not about, or is not only about, technical responses. It's about human responses. I was telling some friends in one dinner that Julio invited me some months ago that I know a lot of you are probably medical doctors in health ministries, but you will learn that your headache could not be cured with an aspirin, no? Or you can see that your ministry will be paralyzed and your diagnosis as a doctor will be absolutely wrong. No? It's paralyzed, but you have not any drug that could fix that. So you need to address that in a different way. So you need the technical responses, yes, but you need the adaptive responses. So you need to be able to make the people address the problem and the values of the community. And in order to do that, you need to open your ears. Listen, one of the problems we had is the crime was so violent and it started to leave a lot of victims around. And there was a quite important movements of victims in Mexico, blaming everyone, especially the government and so on. I was trying to explain it's not my action, it's the action of the criminals. Because one of the problems, the criminals started to expand each other and trying to control the same territory, they clashed each other, and that started this terrible violence. And in the middle of that, a lot of people pay in the sense that the criminals were absolutely cruel with the people. However, the movement grew, and I decided to talk with them. And I said I want to talk with the leaders of the victims. And they established a set of conditions. It must be a public, it must be an equal table, and it was to be absolutely free, and the conditions. They decided even which kind of cameras and which company was going to video record the, okay? I agree with that. And we had a direct conversation. I can hear them, and they could hear me. And it was a vital moment of my presidency. So you need to hear the people. You need to hear your workers. You need to hear your patients. You need to hear what exactly is happening then. And try to understand that any society or any group or any family or any couple have or has some kind of hidden issues. It's an expression of one of the professors of the Kennedy School, Heifetz. There are a lot of hidden issues in our societies. And you need to be able to hear all those hidden issues. And if you want to be a leader, you need to be able to address those hidden issues directly. And you need to be able to get the people participating and addressing those issues. It's
President
too complex.
Calderón, our time is up.
I know.
I want to
like it.
thank you enormously for allowing us the privilege of hearing you and sharing your experience. And thank you so much for coming to the Harvard School of Public Health.
Thank you.
Terrific job.